next speaker is, let me introduce Brad Black, who who has spoken already, but I don't know. I'm not sure he was given a proper introduction, so let me do it. Brad is the founder and was the CEO of the CARD Center, the Center for Asbestos-Related Diseases in Libby, Montana. Sometime within the past year or so, he stepped down a little bit from the clinical side, and he now serves as Senior Medical and Research Advisor at the same CARD. And he has just done outstanding work in helping, treating thousands of people in Libby, but also educating and advocating to millions of people really in the US about the problems with Libby amphibole and the need to both limit exposure and address the people who have had exposure in the past. So Brad, welcome. Welcome back.
Thank you, Steve. Very nice of you. So it followed up with Dr. Markowitz. We have added lung cancer screening to our screening program at the Center for Asbestos-Related Disease in Libby. And I can't tell you how what we've observed in early detection and interventions and cure. It's just pretty amazing after watching lung cancer kill so many. We're seeing a drop off that's significant, and we'll be reassessing how lung cancer screening has affected our lung cancer mortality in our population when we do an upgraded study in the next 10 years, from 2010, 2020, which we'll be doing. But anyway, we got our program with the help of Dr. Greg Lawn, who was a pulmonologist working with us for 3 years, and along with working with Dr. Henschke and Dr. Yankilovich at Mount Sinai. And they've been extremely helpful in making our program, I think, top quality. We're the first ones in the area in Montana to begin lung cancer screening. So anyway, I'll go on now to talk about Libby amphibole. And let me first say that, we've been at this 21 years doing longitudinal follow-up and care of patients with lung or health effects from the Libby amphibole exposure, which was pervasive in the community, and have gained a great insight into the disease pattern, which has been different than what we've seen in the commercial asbestos exposures. And we also understand that there are, with our work, we've seen associations of autoimmune disease along with this, which was a surprise to us. So we're learning a lot about the toxicity of Libby amphibole, but there's still a lot of worries that I have, and I'd like to share those with you. I'm going to try to go at sharing a few slides with you. And I'll go at that right now. So I think you can all see that. So anyway, I just kind of started out with the first slide, Libby amphibole, just don't sleep on it. And there's many reasons for me saying that, but why do I worry? Well, the fibers that contaminated the vermiculite that was mined in Libby for a better part of a century were basically 95% of those fibers were not asbestos. They were, we call Libby amphibole, a group of fibers predominantly composed of winchite and richterite, which are mineral types that are not regulated. And so as a result of that, when there's discussions and literature on asbestos, you rarely see Libby amphibole brought into any discussion related to the other form, the regulated asbestos fibers. So yeah, further worry. We know now about the low-level exposures and how environmental exposures can be highly dangerous for people. And there's, in general, in the medical world, there's a very poor understanding of the toxicity of the Libby fibers. Furthermore, there's a poor understanding of exposure. Most people don't understand the exposure that occurred in this area, and they don't understand a lot about the relative exposures that lead to disease. And furthermore, recognition of the disease pattern has been a significant problem in the medical community. With all our efforts to try to publish and show it, it's still very poorly understood in the medical world. So keep in mind the scope of risk from Libby amphibole is obviously quite sizable, and most people are probably around the country aren't aware of that still. I know some of us know it well, but we're talking about, it's estimated actually 3.5 million tons of contaminated vermiculite ore were distributed and processed across North America. And of course, it was sold as insulation. The vermiculite products were used in agricultural products, used for packing materials. You name it, it had a very wide array of uses. So anyway, the risk from exposure to Libby amphibole lurks virtually everywhere on our continent. So Libby amphibole is a prominent source of legacy asbestos, that material that's in place and will be there for years. The vermiculite from Libby was utilized in over 15 million homes and buildings around the US and North America, all of which contained significant amounts of the Libby amphibole. So a good example that was brought to my attention by Dr. Lowen, he one day called me and says, "Do you know anything about the ghost tower of Calgary?" And I said, "Well, no, I don't." And so he pointed me to a link, and I go to look at it, and lo and behold, there's a 37-story structure with steel beam construction in downtown Calgary, which has been empty for 2 years. And it turns out the ventilation system in that building it was putting out particulate matter, and it was tested and found to be the Libby amphibole within this material that was coming through the ventilation system for years in this building where thousands of people worked for an oil company. So obviously they're sitting there without, there's been no health assessments at this point. It's been tied up in a lot of different things. But the point of this whole thing is this was spray-on Monaco, that it was a W.R. Grace product. I can't tell you how many places we're going to find this. And so when people think this is Libby's problem, it's much broader than that. And this is just an example of the ghost tower of Calgary. You need to look it up. It's just another reason that Libby amphibole needs to be known about. And as much as we try, once again, it's very hard to get there. Now, once we get to a regulation status with these fibers, which I know Linda ADO is continuing to work hard to bring the Libby amphibole into the ban asbestos bill, which I really appreciate. I think it'll also help. So anyway, let's just briefly, I want to tell you mortality due to Libby amphibole for me in a community where I've lived and known everybody and been one of the exposed individuals. It's just humbling to realize we didn't see it, we missed it. Until we realized in 2000 what was happening. Anyway, Lincoln County, Montana experiences asbestosis mortalities as high as any U.S. county in North America. Unfortunately, we're going to stay there for a while. As you know, the latency of the disease and the last heavy exposures were up to 1990. So we'll continue to see significant mortality going forward. What should be pointed out is mortality includes a large number of those with environmental exposure. So let me just take the last slide here. So we've recently completed a card mortality study, which will hopefully soon be soon published. Anyway, in this process, this study was initiated by actually Dr. Arthur Frank and Dr. Alan Whitehouse, the late Dr. Alan Whitehouse, who did all the groundwork and went through the mortality in our card population from years 2000 to 2010. Using death certificates and best evidence as by a method used by Dr. Selikoff in the past, they determined that there were 203 deaths out of 203 deaths in that time frame. That there was a sizable component of asbestos or death from asbestos-related disease, being 55%. And about half of those that died from their asbestos-related disease had non-occupational exposure, which is just unheard of. This is unheard of, and this is more related. This is a figure more related to industrial exposure and very high exposure levels. So it shows you that low exposure in these environmentally exposed individuals, even at that lower level, is very, very deadly. And so that is one message that needs to go out and around to many people, not realizing that you don't have to be sitting in an environment of constant dust and visible exposure to noxious inhaled material. It's very silent, and if people don't realize sources and what they're doing and disturbing, then it could be significantly hazardous. So I would want to just say this: hey, bans are really getting popular these days, so shouldn't we at least be able to ban asbestos? It just makes sense, doesn't it? So anyway, hopefully we'll get there. I do want to at least say a few words about folks on the Hill that have been extremely supportive. And of course, our Montana senators, Senator Daines and Senator Tester, have been supporters of CARD for the long term, and they've stood up on behalf of ADAO and the banning of asbestos. And so I'm just really proud that Montana has good representation. Of course, it's great when you can go outside of the state. And here we have Senator Merkley, who has been a real leader in this also. So we feel very fortunate that we have people that are listening and understand, and it's great to have them working on behalf of public health. So I'll end it there. Thank you very much.